Okay, hi there, you guys. I'm going to be a little bit confused because I am confused. Had my meeting with Klimas, and it was nothing short but amazing. That woman walks on water. If there are any of you that out there that doubt she is nothing short of holiness, Klimas is unbelievable. She is the most calmest, nicest, approachable, friendly person. Her intelligence doesn't stop. I typed up my letter of about 3 pages and I put everything into 11 groups of discussion because it's my eye, it's my heart, it's my immune system, it's the breast cancer issue in my family, it's the this. And we went after each thing. She had a doctor in there with her, a male doctor who was visiting, and his name is Richard Podell. I'm going to have to Google him and see who he is. From New Jersey, don't know who he is. But he sat in on the meeting, and we went off of these sheets. Now, the first thing I had started with her with was this, which if you put in those words, Dr. Lerner, and he's got the 10 steps, and the truth is I've got to do this right. You know, the more you can talk in the doctor's languages on their meetings, the better it can be. So I said, okay, doctor, I call her Nancy. Nancy, let me tell you, this is the scale I'm using. I'm going to tell you which numbers on the scale I've been and for how long. And so that gave her a reference point without going into everything. She also told me that I had done a very, very good job of organizing. Now I can't organize myself now if my life depended on it. She said I had done a very good job of organizing myself for the meeting, and she was really happy because I don't think a lot of people are as organized as I am. Although right now I can't find the cover page. Oh, here it is. So, and I've written all over it, and then I just said, Nancy, you're going to have to write all this down. So I will get a letter. And this is probably going to be a long video. It was an hour-and-a-half meeting, an hour-and-a-half. And every minute we just moved along because there was that much discussion. So, for example, let's see here. Okay, so I have, the first group was cancer. The second one was optical neuritis with the issues that are scotoma and all this stuff. Group 3 was whole natural killer cell test. Group 4 was the AFib, the ventricular tachycardia, supraventricular, all that. Then, I needed some sleep suggestions, the common variable immune deficiency, the myofascial pain syndrome, the postural orthostatic tachycardia syndrome, the viruses with something reading not right on the the Lyme test. It was very passive. We revisited the picture with all the conditions. We talked about my discs, and then we finally got to what is the current program. Everything you had recommended I was off. How do I get back on it again? Well, there's so much information, but regarding the cancer, knowing that 3 of my sisters have cancer, breast cancer, and 1 is dead of the 3. My mom died of breast cancer. My aunt had breast cancer. She said, you got 50%, Francesca, 50% chance you're going to get breast cancer. And I went, oh, okay. Wow, I knew it was really, really high. The fear seemed like 90%, but she said 50, which means that's actually probably more better than what my fear in my psyche says to me, because the psyche makes you feel like it's 150% chance you're going to get it. And I said, she said if it was her, she'd go have a double mastectomy. She wouldn't screw with it. And but then she said that if they don't get all the meat tissue off of that chest cavity and you get the reconstruction and then you don't do all the follow-up visits, you could have the cancer start on that chest cavity and no one will ever find it. So you better find a doctor that doesn't leave anything on that chest cavity of any breast tissue, anything. So I said, okay. And I said, all right, well, I'm not in stable enough health to have a double mastectomy reconstruction right now. I'm not stable, and that's something that would have to be programmed. So she said, okay, what we're going to, and I told her, I said, I do an MRI contrast, and I get the mammogram. She said, January you do the MRI, July you do the mammogram, and every 6 months you've got one or the other test coming in, so that hopefully every 6 months you're being checked. And then I said, well, what about the echo? Because the mammogram doesn't really find the cancer normally in my family. She said, okay, do the echo with the mammogram and do the MRI on the other side, but every 6, and just stay on it. She also told me that getting back on the Imunovir was probably going to be the best drug that would stop me from getting cancer. And she made some kind of comment like, maybe, Francesca, your body, because my dad died of lymphoma, mom died of breast cancer, 3 sisters with breast cancer, maybe your body decided to give you a warning sign before you got cancer. And I've always thought that. And I got sick this way, although my guess is it's inevitable one day I would get the cancer, kind of is the impression I'm getting from her. But now that I've got this warning sign with the low natural killer cells, which we'll talk about later, I got a blessing. And by me getting on Imunovir, it's going to help. By the way, I have a wool sock on my neck, and I have Vicks Vapor Rub all over my neck because my neck, my throat is really bad with the swollen glands and burning and hurting. And so what I do is I coat my neck with Vicks Vapor Rub at night, and then I wrap a wool sock around it. And I still am waking up with a bad sore throat this morning, so I haven't taken my sock off. I did put on more Vicks Vapor Rub. Okay, number 2, the optical neuritis, central scotoma, keratitis, cornea, and Ufthoff phenomenon. I'm going to have to, when I write a letter to her today, because she's going to write me a report, I'm going to have, oh my God, see, it's already 6 minutes to go over this stuff. I'm going to talk to her more about the Ufthoff. She says that her eye specialists down there in Miami say that there are tons of people, the eye specialist says that you can have shingles going off in your blood without it showing up on your body. And without it showing up on your body because it's doing something to attack something in your body. And the fact is I was having the optical neuritis episode. So she suspects that the shingles was attacking me internally with the optical neuritis. She agrees with that theory because there's a lot of different doctors' theories going on as to what actually happened to me. I then explained to her that the 2 different doctors, both 100% Italian, one in Denver, one in Rome, said you had a stroke, came out of your heart, because it came out of the heart and it hit your eye, blood clot, and you had a stroke in your eye. The issue is one doctor says the stroke that you had in your eye is the stroke from 2006 when you did have 3 strokes. One of those strokes hit your eye then and you're getting scar tissue now. The other doctor said, that's all possible, but you know what, Francesca, you suffered a migraine one night, you were crying, you were vomiting, you were in pain, and then your vision went out severe the next day because the blood clot was occurring, the embolo was occurring then, and you stroked that day. And I have a YouTube video. I don't know if I took a bunch of my videos down, but she said that she would be prone to say that when I was having that supraventricular tachycardia out-of-control episodes, the heart threw out a blood clot and it hit my eye, which I did have 3 strokes back in 2006 after the open heart surgery. She wrote a whole bunch of things. She says the thing, it was so much information. I think they stick a needle in your eye and they take liquid out of your eye and they biopsy the liquid, and then while the needle is in your eye, God fucking help me, they then put medicine in. So she's going to write this all up, and then she said for 6 months it'll help your vision. But I'm thinking, I don't need my vision helped for 6 months, you know. But there's a certain thing they put in. But she says we need to know if in addition to having the stroke that caused the blind spot, did you have shingles get in there? Did you have Epstein-Barr? Did you have something else come in? And is it there and is it active? She said something about running all these blood tests, PRVs or PVRs, but man, it was so over my head, and I just begged her to death, put everything in a letter, and I'll research it when I get the letter. Okay, I'm going to have to write her and say, could you clarify, why am I getting the Ufthoff? What was that tied into? Uhthoff. Okay. Now we're on number 3, natural killer cell test. the strategy, and she had all my medical reports, but I took the data out and I outlined it and said, when I saw you on this date in Miami and you tested the natural killer, it was 1.78, which is horrible. You put me on Imunovir, and then your lab 3 months later tested me, and I was at 11.44. So from less than 2, I went over to 11 in 3 months, which she said was miraculous, better than anybody could ever expect someone to do on Imunovir, and that was an instantaneous response. So she knows I respond based on that fact. I then continued to have stay on Imunovir, pulsing the way she had always told me. And 2 years later, while I was on it, I got checked, and my natural killer cell was at 35.6. She said, fantastic, those are the numbers you've got to keep up to try to not get cancer. Then I said to her, well, I've been off of it for a year. And I went and got tested, and I'm at 34.2. And I said, am I writing the residual of that medication? She said, absolutely. And what she came up with was really interesting, because she listens to all of your problems. She came up with a new schedule. She said she wanted me to do it one way, and then she said, you know what, cancel everything I said. It was going to be 1 month on, 2 months off, 1 month on, 2 months off for 4 months. And then she came back and she said, no, Francesca, this is what I want. I want you now to start Imunovir for 3 months, and you stay on it for 3 months, and then you're off of it for 3 months, on it for 3 months, and off of 3 months, and you take it for life. End of conversation. And you continue to get these tests done, and you stay on that program 3 on, 3 off until I tell you otherwise. Okay, fair enough. So that made me feel good. We talked about the vitamins. She said taking the prescription vitamin D, absolutely keep it up there. The B12, absolutely keep it up there. And the D needs to be at 60, and the B12 needs to be at 900, period. So if your doctors say your low levels are fine, no. Then we talked about the supraventricular tachycardia, atrial fibrillation, medium apical hypokinesis of IVS. And she had an interesting comment. She said, Francesca, she thinks that this damage that occurred, hypokinesis, she says that she believes that it's not due to the viruses or an infection. Although that's what they went into my heart looking for the thing I had to swallow, the TEE. They didn't find anything. She said, no, I think it's because you had too much atrial fibrillation, and it stretched out the heart in that area. And usually, if they get the AFib under control, then they can not have the heart be stretched out that way, but it appears that you've got permanent damage. And she was totally off the wall, kind of agitated with me a little bit in a positive way about my heart, and said, you taking this 81 milligrams a day? No, you're up to a full aspirin every day for the rest of your life, and if you're only taking one drug, you are doing that. She says, I guess she has an aunt who refused to take her aspirin, and something happened to the aunt, and the aunt is not quite a vegetable, but she doesn't respond, or she's got some kind of permanent damage that absolutely destroyed her life. And she said, Francesca, I'm not going to let that happen to you. So she also wanted me to take like 300 and something milligrams of aspirin every other day, so that way if you forget, you're always covered. But I'm not sure. I'd rather do the 162 a day, but bottom line is I've got to start. She was so adamant, pushing that point, making me promise that I would take the aspirin because I've been negligent. And it was funny because I said to her, well, Nancy, I'll submit to you. And she just started laughing, and she said, oh, thank you, Francesca. It's not like I'm your doctor. I'm just advising you, And I said, no, Nancy. I said, I just don't submit easily. It's not my character, but I'll submit to you. And she just laughed, and the other doctor in the office laughed. And, because most people, if the doctor says, do this, you go, okay, I'll do this. And I just said, my response was, okay, I'll submit, because for me, that's what it felt like. It felt like it. I'm in love with this woman. I'm just in love with her. The heart rate being so high was a problem. Then the pulse intrinsic factor every year, It just went so much information over my head. So I'll wait till I get her letters. Okay, so that was the heart thing. Now, sleep aids. I listed out the 3 that the guy from Harvard School, Dr. Anthony Koffahoff or something, and she said, nope, Francesca, I don't want you getting on any sleep aids. You don't need that. Your brain's working, you're sharp, and you get on those sleep aids, you're going to become dopey and draggy. It's going to have more problems. So we're going to find something else for you. She said, you get back on that low dose Naltrexone, and let's see if we can't get you sleeping right without sleep aids. I said, all right. So sleep aids are off the table. Then we talked about, this was interesting, the common variable immune deficiency. And I showed her what Dr. Isaac Melamed had, all his testing, and she saw it there. And I said, I don't know, this is what he says I have. And she looked and she said, Francesca, yeah, I can see exactly the path he went, and I can see the criteria he used to diagnose you with it. And I said to him, I said to her, I get the treatment with the IV 3 months when I'm in America. She said, well, why aren't you getting the rest of the year? I said, because the doctors here in Italy wouldn't support that diagnosis, and because they have a much more rigid or narrower expectation of the diagnosis, and I can't get the treatment here. And she said, well, we're going to fix that, because there's a way you can get IV syringes injected of this, and there's some other positive effect for getting immunoglobulin. I can't remember, maybe putting your immune system up. And she said, what we're going to do is I'm going to write you the prescriptions for all this. I'm going to refer you to my contact person. You have to go through a home healthcare agency or something, and we're going to try to figure out that you either come back to America, an extra visit, and you grab the drugs, or we find out some other way. And that's when I said, well, maybe we could send it to the Vatican in Rome, because I said, if I'm in the country for 3 months of the year, during those 3 months, I've got the drug. When I leave in September, like the first part of September, then that means September, October, November. So I can leave in September with a 3-month stash that'll bring me to December. I've got to come home in December, get a treatment. Problem is, when I leave in January to July is 6 months. I could leave with another 3-month stash, so it means there's one window of 3-month stash that I'm exposed on not having. She said she's going to put it in a letter, work it out, and she wants me to start doing these syringes of the IgG once a week. It's funny, because I kept wanting to say, aren't I going to go back on Valtrex? Valtrex was the easy drug compared to Imunovir and low-dose Naltrexone. And she said, nope, we're holding off on the Valtrex. Just put that up, baby, on the side. We're doing the Imunovir, the low-dose Naltrexone. We're going to move along with these injections. I mean, the woman is just a bottomless pit of knowledge. It's amazing. We talked about the myofascial pain syndrome, and that came out to be all the low-dose Naltrexone. The other thing that was funny is when we were doing this, going over this, I'd say, okay, you answer that. Next one, she'd say, hey, I'm not done on this one, Francesca. We have more of a discussion. There's more things we have to talk about. So each one of these 11 bullet points, I'm looking at the clock going, shit, an appointment's a half hour. She knows she needs an hour with me because I have so many health issues. And here we're going over an hour, and so I'm trying to rush it for her, and she's like, no, we're not done. We're not done. She's so funny, so sweet. And then we came back to number 8, the POTS, postural orthostatic tachycardia syndrome. Well, the thing was, she said some other things, and I so wish I couldn't tape record it yesterday. But she said, you, Francesca, your situation with all of those numbers are just a mess with the POTS. And I was like, oh, okay. I knew it wasn't good, but, it's a little bit more than that. And I'm like, okay, well, I wish I kind of understood the language, but I don't. But there's NUUN, NUUN, which is a product that Dan, who is one of her clients, who runs one of these programs, I don't know what you call it, the nonprofits for our illness, who first originally put me with her, said, get these products. So I talked to her about them. I said, listen, I don't want steroids. Oh, that's the other thing I forgot to mention. Let me back up 1 second. On the CVID, well, actually, let me talk about the NUMS, and then I'll return back, because that other part's a big piece. She said, okay, Francesca, if you're not going to do steroids, which I don't want to do steroids, she said, you are to take 3 NUMs a day. 3. And I said, okay. You got to drink 1.5 liters to 2 liters of water every day. You got to do 3 NUMs, and I want you jack and salt all over everything. Just bathe everything in salt until you can make your numbers go up. She said, eat all the olives you want. Start eating those olives over there because they're really salty. So I said, okay. So that's going to be, and so she did confirm that NUMS is a good thing for POTS. Now, going back to the steroid issue, well, I'll do this last one, and then I'll go back to the steroid for the common variable immune deficiency, because she had a theory. I said to her about the viruses. She did say that once you start getting the immunoglobulin IV treatments, that before 4 months passes, if you get your blood tests, you will constantly look like you have all these viruses, because the donation of these products have the antititers or antibodies in them. And I said, well, I've never had Coxsackie. I've had B1 and B2, but I've never had all the Coxsackie viruses, and here they showed up. I said, I've never had this, and now it showed up. I never had this, and I said, I told her which ones I had. And so when you're taking these immunoglobulins, all of a sudden now you can't even use some of your tests. So then we talked about also that one number was off that looked like it could have been the tick thing, and she said, no, Francesca, just let that go. It was so minute, minuscule, nothing, just let it go, move on. I said, okay, but we came back to this issue of which viruses were activated or not activated. She explained a concept to me that I don't 100% understand. But what she wants, she said, when you do these IV treatments, I want you to go on 2 or 3 steroid prednisones or something like that prior to the IV treatments, because she thinks that one of the IV treatments, I must have had one virus starting, if I understood her. I got the IVG, and it then flagged all of them, and the immune system went wacky and registered that all of the viruses I've never even had, were active. And so there was some kind of whole dialogue that she said, from this point on, when you get the IVGG in the States, I want you shooting up, or not shooting up, but orally taking some prednisone prior to you getting that treatment. Now, what I don't know is if you're putting me on the needles over here, I don't want to stay on prednisone, but maybe you're getting a low dose. I'm not really sure. So, but she is just this amazing fountain of knowledge. We talked about my discs being all screwed up. And she said, listen, Francesca, the minute your hands are going numb or losing control of function, you're having spinal surgery. As long as you feel your fingers and all of that, and you can control your hands, you're okay. And so she thinks that we might be able to put that whole thing off, although I probably should send her that report, which I haven't. She wants me to stay on the NeuroProtek. She felt good about that. The D, she liked the Ubiquinol, 100 a day. The cardioaspirin has to go up. This thing that's this glutathione, you can take it orally, and there's a lot of buzz on that. She said, don't waste your money. Don't even bother, because it is almost impossible to get orally absorbed. So don't even bother, and I did read that some people were doing injections. She said, let it go. I asked her about the GC muff, and she said, Francesca, now with this whole cancer family issue, stay away from the GC muff, which is what Dr. Allender, E-N-L-A-N-D-R, recommends for ME/CFS, which is good, but she said it could go funky on you, and it could activate your family story of cancer. So don't do GC muff. Then I said, what about this alpha lipoic acid and this acetyl L-carnitine? And I said, I've got them. She said, well, you can take them. You can take them in the morning. Don't be taking them late at night, because they can jack people up and keep them awake. So, but right now, now the other thing was, I showed her my daughter's natural killer cell tests. And she said, I don't like the numbers. Your daughter's numbers are low, Francesca. We have to look to see and get some tests done as to why my kid is having vitamin deficiencies, although I did get I did get her B up by taking Jarrow orally. I need to have her tested here soon to find out where her D is, to see if her taking my oral D, vitamin D, is helping her. And there was another thing. They want her iron checked again, and they want her checked for celiac sprue, and then there's some other test. The only problem is she said I can't write any of that down, Francesca, and I'm so confused now. Things I have written down is PCR virus, PCR fluid out of the eye, and then they put in this gandocholine or something in your eye, but she's supposed to write all that down. That's okay. Intrinsic factor. I'm supposed to look at what this intrinsic factor means for my daughter. Salt, pre-medicate with steroids. Richard Podell was the doctor. Probiotics. I'm supposed to make a photograph of the label of the probiotics, send it to her, and she wants me and my daughter on probiotics, which I'm on it. Anyway, an amazing visit. I've got my hands full. Okay, 25 minutes, see? Just to discuss the highlights, because it was just that intense. Bye, you guys.